In this video, we will talk about the pectoral region of humans. This includes the bones and muscles of pectoral region. What is a pectoral region? The pectoral region lies in front of the chest. It is also known as the anterior thoracic region. It encompasses the anterior chest area. It consists of structures that connect the upper limb to chest wall. Bones of the pectoral region. It consists of 3 bones: the clavicle, the sternum, and the scapula. We will look at them one by one. Clavicle, also known as collarbone. Location: it extends from the sternum, medially, to the acromion of the scapula, laterally. Functions of clavicle: it serves as a strut to keep the scapula in place, enabling the arm to hang freely, away from the trunk. It provides attachment sites for muscles. Sternum, also as the breastbone. Components of sternum: it consists of manubrium, body, and xiphoid process. Functions: it protects the heart, lungs, and major blood vessels. It provides attachment for ribs and clavicle. Scapula, also known as the shoulder blade. Location: it lies on the posterior thoracic wall. Functions: it provides attachment for several muscles and articulates with the humerus and clavicle, to form the shoulder joint. After bones. Now we will discuss the muscles of pectoral region. There are 4 muscles in the pectoral region: Pectoralis major, Pectoralis minor, Subclavius, Serratus anterior, Pectoralis major. Origin: it originates from clavicular head, medial half of clavicle, sternocostal head, sternum and upper 6 costal cartilages. Insertion: it attaches to the lateral lip of the bicipital groove of the humerus. Functions: it adducts, flexes, and medially rotates the humerus. Pectoralis minor. Origin: it originates from 3rd to 5th ribs, near their costal cartilages. Insertion: it is attached to the coracoid process of the scapula. Functions: it stabilizes the scapula by drawing it anteriorly and inferiorly against the thoracic wall. It draws the scapula forward with serratus anterior muscle, subclavius muscle. Origin: it originates from the 1st rib and its costal cartilage. Insertion: it is inserted at the inferior surface of the middle third of the clavicle, in the subclavian groove of the clavicle. Functions: it anchors and depresses the clavicle. It steadies the clavicle during movement of shoulder joint. The last muscle of pectoral region is the serratus anterior muscle. It is also known as the boxer's muscle. Origin: it originates from the upper 8 ribs, in the mid-axillary plane. Insertion: it is inserted at the anterior surface of the medial border of the scapula. Functions of serratus anterior: pushing and punching movements. It pulls the scapula forward around the chest wall, to protract the upper limb. It rotates the scapula to allow the arm to be raised above the head. It steadies the scapula during weight carrying.